Hi everyone, thanks for hopping on. I'm Jen, nurse practitioner here at Northeastern Reproductive Medicine, along with being the third-party director. I'm here with Logan, who is our third-party coordinator, along with Jess, who is our egg donor coordinator. Happy to have everyone on. We're going to be talking about gestational carriers in this presentation. I will do a little introduction. I will discuss who's a good candidate to be a gestational surrogate, timeline, the gestational carrier process, and the intended parent process. There are many ways to make a family, and one way is the use of a gestational surrogate or gestational carrier. A GC is someone who would agree to carry your child in their uterus without contributing any genetic material. So the embryo has been made with whatever DNA genetic material, and then a gestational carrier is offering their uterus to carry the pregnancy. Intended parents, or IPs, or the gamete donors contribute their genetic material to create the baby. The intended parents' names will be on the birth certificate as the baby's parents. It's just the GC that carries the pregnancy. To promote the safety, well-being, and best interest of you, your baby, and the gestational carrier, NRM follows all the FDA required and American Society for Reproductive Medicine, ASRM guidelines, which will be reviewed throughout this presentation. Who is a good candidate to be a gestational carrier? We want the gestational carrier to be between the ages of 21 and 45. They should be a non-smoker U.S. citizen. They should have reliable transportation, stable home environment, excellent physical and mental health history, no medications that would be harmful to a pregnancy that they're on a daily basis. They should be vaccinated against the COVID-19 virus and the influenza annually per guidelines from the CDC. And they must have given birth and parented at least one child and no more than 5 deliveries. And of those 5 deliveries, no more should be 3 C-sections. And they must have all been uncomplicated pregnancies. There are 2 paths to finding a gestational carrier. You can elect to use someone known to you, for example, a friend or family member that has volunteered their uterus for you to use to family build. Or you may utilize an agency who will find a gestational carrier for you and match you up with them. Regardless of your path to finding your GC, you will work through an agency, and the evaluation of the gestational carrier is the same, whether you found the gestational carrier or you were matched with them by the agency. Our recommendation, who we use a lot for gestational carrier agency, is Vermont Surrogacy Network, but we will work with any agency that the patients would like to use. Agencies are key in several steps of this process, with matching a GC, the legal documents prepared by specialists in family law, escrow account setup, health insurance review for the gestational carrier, criminal background checks, and much more, in addition to providing tremendous guidance and support through the process. So kind of an overview and timeline of what things would look like. You would meet with our provider and have a financial consult and make embryos if you haven't already. That can be anywhere between 1 to 3 months. You'll then work with an agency and match with a qualified gestational carrier. That can be anywhere from 3 to 12 months, depending on the matching process and what gestational carriers are available. Once you have matched with a GC, we will work that GC up in our office to make sure they are a perfect candidate for you to carry your baby. It's approximately about a month. And then once we clear the GC to be medically cleared to be your gestational carrier, you and the GC will work to execute legal contracts, which take about 2 to 3 months, and you'll do that through the use of the agency. And then we will perform the frozen embryo transfer into the gestational carrier to create a pregnancy. It takes about a month. Gestational carrier process, this is after your embryos have been created. We do a diagnostic workup of the gestational carrier. We want to make sure that they are truly the best candidate for you to carry your baby. So we do a new patient appointment with the physician. You are welcome to come to that visit with the provider. We do a uterine evaluation called a sonohystogram, which evaluates their uterus to make sure there are no noted barriers to future pregnancy. Remember, they've already been pregnant, they've had an uncomplicated pregnancy and delivery, so we just need to make sure that nothing has changed with that. We do infectious disease testing on both the GC and any GC sexual partners. We also do a psychological meeting. So partnering with a GC to build your family is a wonderful and complex process. American Society of Reproductive Medicine recommends a clinical evaluation by a qualified mental health professional to address the moral, ethical, social, and emotional stuff that does come up related to this process. The IPs will meet first with the qualified mental health professional, then the GC will meet and the GC partner, and then you all separately meet with the qualified mental health specialist, and then you all come together as a group to meet for a joint session, which is a lot of times wonderful and very rewarding. Legal agreements between the intended parents and GCs are done, and then once all of that is completed, we'll move into the frozen embryo transfer. Frozen embryo transfer process, it takes about 2.5 to 3 weeks from the start of your gestational carrier's period to prepare the uterus for embryo transfer. We will communicate the dates of your gestational carrier's appointments and then the tentative transfer date, which is awesome. You may elect to be present for the embryo transfer either physically or virtually. We'll help you either way we can with those dates. And 10 to 12 days after the embryo transfer is the pregnancy test. At this point, if pregnant, the GC is about 4 weeks pregnant. The NRM team will continue to provide care for you and your gestational carrier until you graduate to the OBGYN at about 10 weeks gestation. Can we transfer more than one embryo? We get that question a lot, so I wanted to do a slide. No, we do not. The American Society of Reproductive Medicine, ASRM, and the CDC recommend that individuals transferring an embryo should be one embryo at a time. The reason is that you see the numerous health risks that are listed here and much more for twin gestation and triplet gestation, but almost 3 out of 5 twin babies are born premature. About 1 in 4 twin babies are admitted to the neonatal intensive care unit, and about 7 in 1,000 twin babies have cerebral palsy, which is 4 times more likely for a twin baby than a single baby. So by transferring one embryo, we're limiting the risk of twin gestation, is essentially why we say we transfer one embryo at a time. So that is that. Intended parent process. So if you haven't created your embryos already, you would create your embryos to be prepared to put them into a gestational carrier. We would do initial screening of the egg source and sperm source to make sure reassuring negative infectious diseases, genetic carrier screening results, ovarian reserve, and sperm parameters are met. We would stimulate and do the retrieval on the egg source or patient, depending on the medication protocol. That can be 2 to 4 weeks from stimulation start to the retrieval, and then to create embryos. And you'll get updates throughout this process on how the ovarian stimulation is going, sperm parameters, and embryo creation. FDA eligibility. If you haven't created your embryos yet and plan to use them in a gestational carrier, we will make them FDA eligible, or we will try. We will test both the egg and the sperm source per the FDA published guidelines. While there's no method to completely ensure that infectious agents will not be transmitted from the embryo, egg, and sperm to the gestational carrier, or from the gestational carrier to your baby, these guidelines, combined with information about everyone's history, should significantly reduce the risks. And this is just an ending quote that I wanted to leave you with. Whenever and however you intend to give birth, your experience will impact your emotions, your mind, your body, and your spirit for the rest of your life. By Ina Mai Gaskin, who was one of the first midwives, I believe. Our website, phone number, address. Thanks so much.